you're smiling, when you're smiling, when you're smiling, when you're smiling, the whole world smiles at you.
Hello and welcome to College Confidential. I'm your host, Nicole McFadden, and today we're going to be talking about something that affects approximately 1 in every 700 babies born. Cleft lip and palate is essentially a gap or fissure that can appear in either a baby's top lip, the roof of their mouth, or both. As a parent, finding out that your baby could be born with such a deformity can be stressful. However, in most cases, the problem can be fixed quite easily with surgery shortly after the baby is born. In the first half of today's show, we will be talking with plastic surgeon Dr. Damir Maddock, who specializes in cleft lip and palate surgery at the Thames Valley Children's Centre here in London. He explains how the surgery to correct a cleft lip or palate works and how an affected child can heal and grow up to look almost like nothing ever happened. We will also speak with coordinator and speech pathologist of the LHSC Cleft Lip and Palate team, Anne Dworshak-Stokin, about the support families need to move through the situation from birth to early childhood. Later on, we will also be talking with families who have had a child with cleft lip and palate and their experiences dealing with the repair process. Dr. Damir Maddock of the Thames Valley Children's Centre is a plastic surgeon specializing in cleft lip and palate corrective surgery. He's part of a team that's been put together at the Thames Valley Children's Centre right here in London. The team is made up of Dr. Damir, the craniofacial surgeon, a dentist, an orthodontist, a speech pathologist, and various other counselors. They work together to make sure the patients get the attention they need and can be monitored closely. He says while a number of factors can predict whether a baby will be born with cleft lip and palate, the amount genetics plays in the mix is unknown.
There's definitely a genetic component. We know that if you've had a cousin or a family member with cleft, then the chances of you having a baby with a cleft is higher than if there was no family association. So there is a genetic component, but it probably is not a simple component. It's probably a combination of things that have to come together to create a cleft because nobody's been able to isolate one gene or one particular area.
Some other environmental factors that can increase the chances of cleft lip and palate are when parents are over the age of 35 and things like smoking as well. Repair surgeries begin as soon as the infant is strong enough when it comes to a cleft lip, usually at around 3 months of age.
Mainly because the kids are sort of big enough by then to have an anesthetic without increased risk. And they're not old enough that they're sort of learning to walk and falling on their face.
Cleft palate surgery is something different and occurs later on.
Palate surgery happens more related to how the child is developing in terms of speech. So we start developing words at around a year of age. So we'd like to have the palate fixed by then so that they have an intact roof of mouth so they can develop the words and develop language like we want them to.
One of the final steps in the process involves the teeth and gums, which Dr. Maddock says occurs later on in childhood.
We wait until the adult teeth start coming in, and oftentimes that requires putting some bone in the gum to let the tooth erupt, and then we can use braces to sort of move the teeth around.
We're lucky enough in North America to have the resources available to make cleft lip and palate surgery a viable option. However, some people are not as fortunate. Dr. Maddock says in many places such as India, when children are not treated for this condition, they can be treated differently by their peers and even shunned, not to mention the various health effects that can result from non-treatment.
Nutrition is going to be difficult when your nose and mouth are connected. It's hard to swallow, and obviously hard to develop normal speech when your tongue has nowhere to sit if you don't have a roof of your mouth. So the consequences are huge.
While cleft lip and palate surgery is not Dr. Maddock's only area of expertise, he says there's a reason he's chosen to spend most of his time with the lip and palate team at the Children's Centre.
Operating on kids is very rewarding. It is the second commonest sort of birth problem that we have, club feet being the commonest, and this is then second and the commonest facial thing. And the face is important socially. It's something that we look at from a communication perspective. We judge people based on their appearance. And so it's a challenge from a personal perspective.
He says this type of surgery presents a very unique challenge for any surgeon.
Growth happens for the first 18 years of their life. And I can't devise an operation at 3 months of age that's going to sort of grow with the child and continue to sort of develop like a normal lip will be. So that challenge is continued in the child and in sort of what I have to do up until they're finished growing.
Oh, you make me smile.
Shaq Stoken is also a member of the cleft lip and palate team at the Thames Valley Children's Centre. People are referred to their team from all over Canada. Anne meets with parents who have been informed their child will have a cleft lip or palate, sometimes even before the baby is born.
We'll go over what the cleft lip and palate team is here in London, who's involved, timing of the surgeries, how and why cleft lip and palate happens, and most importantly, too, in terms of what to expect after their baby's born.
Anne says one of the most important things they discuss is how to ensure the baby is getting proper nutrition.
The feeding can be very difficult if you're born with a cleft lip and palate, so we review what the potential difficulties will be and how they can become the expert at feeding their own baby.
There are many techniques that can be used to help the baby feed, one of them being a special bottle known as the Haberman feeder. It's designed especially for babies with cleft lip or palate and can be used by applying pressure with the tongue and gums on the extended end, rather than sucking, which can be difficult. Anne says when most parents are informed that their baby is going to be born with a cleft, their first thought revolves around what their baby is going to have to go through to fix it.
Most parents will say, well, their baby's going to need surgery. What type of surgery? That's probably the first thing that comes across their mind, because when they look up some pictures, they usually will represent children who have a cleft lip and palate. As Dr. Maddox says, it's very visual. You can see the difference compared to other babies.
The whole process continues from when the baby is born all the way into late childhood, with special focus on years 1 through 5 when the child's speech is developing.
We're a team, so we have orthodontics, dentists, social work, plastics, genetics, ears, nose, and throat, speech pathology. We work together as a team and we follow them till early adulthood. How we follow them is done through cleft lip and palate clinics later on in life. So we'll see them every 1 to 3 years, and we'll continue to follow them till like 18, 20 years of age when their treatment's been completed.
Anne is also the speech language pathologist at the Thames Valley Children's Centre. She follows the child pre and post surgery and up until the child enters the school system, where the school speech pathologists are able to take over.
Through all the screenings and assessments that we do about every 6 months, if we identify that there is a delay or that there are concerns, we address them at those times. And as I said, we try to be proactive too, number one, by education, but also by giving them techniques and methods of what things that they can be doing to help to promote speech and language development.
Having seen a lot of children pass through this whole process, Anne says she's amazed at the results she's witnessed.
It's amazing how quickly after 6 weeks when Dr. Maddox sees them again, how the swelling's gone down, the redness has gone down. When I see the kids every 6 months to review their speech and language, sometimes I don't even see the scar. That's how good it looks.
You smile, I smile. Oh, 'cause whenever you smile, I smile.
As Dr. Maddox said earlier, the face is a social tool for humans. As unfortunate as it is, many children with visible clefts in their lip that have not been treated properly can suffer psychologically. In many third world countries or places where healthcare is not so accessible or affordable, many children can even be shunned. Operation Smile is one of the many organizations around the world that raise money for this cause. Katie Henry is the president of the Operation Smile Club at Western University here in London. She explains what it's all about.
Operation Smile raises money to send doctors and surgeons, volunteers to third world countries to do surgeries for kids with cleft palates and cleft lips and other facial deformities.
Katie got involved almost by chance.
Actually, my brother told me about the charity in the first place, and then when I came to Western, I looked for it. I looked for the club because I wanted to get involved, and I think it's a really good cause, and it kind of just stuck.
The doctors sent overseas are all volunteers, and according to Katie, a cleft lip repair surgery can cost as little as $240.
Operation Smile has planned 81 missions for the 2013 year from January till June. Each mission, they do 300 to 500 medical evaluations on kids, and they perform 100 to 150 surgeries. And it's about 45 minutes of surgery, so they get a lot done.
Operation Smile has been around since 1982. Since then, it's provided more than 3.5 million patient evaluations and over 200,000 free surgeries for children and young adults born with facial deformities. They also train local doctors in developing countries and strengthen healthcare systems so more children in some of the poorest areas in the world can be treated. As a local movement, Katie says that the club at UWO does their best to spread awareness.
We host a lot of events. We host bar nights and we have awareness days. We set up a booth in the UCC atrium and we have some posters and stuff that we put up and just help spread the word about our cause.
Operation Smile does their best to help children all over the world live a happy life. Their mission is to heal children's smiles and transform lives across the globe.
When you're smiling, when you're smiling, when you're smiling, when you're smiling, the whole world smiles at you.
The process is involved. However, as we've discovered after talking with Dr. Maddock and Anne, cleft lip and palate is not something that has to follow a child. If surgery takes place at an early age, many mouths heal almost to perfection. After the break, we'll be chatting with mothers Lisa Kwazik and Carla Alexander, who've both had children who were born with a cleft. They discuss the repair process, their concerns as mothers, and also whether either of the children will have lasting effects. I'm Nicole McFadden, and stay tuned to College Confidential. We'll be back right after this.